My name is Caitlyn Hendrix, and I am a nursing professional development specialist here at the Cleveland Clinic. This presentation discusses the importance of creating a meaningful pre-brief that allows learners to get the most out of simulation. The pre-brief is an important step that helps to set the stage for the learners. While learning how to facilitate simulation, a checklist was created to help guide a facilitator through the pre-brief section. The initial version of this was very basic and included items such as introducing the simulation environment, giving caregiver expectations, and a very rough timeline of the simulation. As this facilitator began to observe other facilitators, it was apparent there were many elements missing from the checklist. Through multiple observations, there were several items that were added. One topic was a brief discussion of previous simulation experiences and the emotions that often followed these stressful situations. After bringing those to light, they would discuss the difference between summative and formative feedback. Summative feedback is more common in school as they are observing your actions to give you graded feedback. Formative feedback is often more informal and helps to identify growth opportunities. Defining the difference between the two always seemed to help ease some of the anxiety for the learners. The second item was using an icebreaker activity to again help ease the anxiety levels that simulation often brings. This was just a simple question such as, if you could go anywhere in the world on vacation, where would you go? There are many variations of this question that were asked, but each time the learners were engaged and seemed to be more relaxed after. After observing several different simulation and facilitators, it was time to jump in and actually facilitate. Using the guide, I fumbled my way through my first few simulations. While the main points were met, I felt that it was very rehearsed and unnatural. After one of the simulations, I received feedback from a coworker that suggested that I attend the simulation educator workshop. Throughout the 2-day workshop, they gave us many tools and tips to help us be successful when facilitating simulation. One of the main tools that was discussed was the debriefing assessment for simulation and healthcare, or the DASH tool. This tool is composed of many elements for the entire simulation and helps to provide feedback and identify growth opportunities for the facilitator. After attending the Simulation Educator workshop, there were many items that were added to the checklist. These items included creating a safe container, a more in-depth discussion of the facilitator's roles, simulation objectives, logistical details, and an opportunity to share thoughts and ask questions. But adding these elements were not enough. This facilitator wanted to make the pre-brief sound more natural and less rehearsed. Within the checklist, there were small talking points that were added to help it sound more natural. For example, instead of just saying, "This is a safe space," it was expanded to say, "Nothing we do here leaves this room. It's a safe space. This is where we want you to fumble, and we want you to make the mistakes in a controlled environment." Another element that really seemed to make a difference was to discuss our expectations of the learners. The checklist does this by saying, "We know that there are some limitations with simulations, but we want you to try and do everything exactly as you would on a real patient. Use all of your assessment skills to critically think about what's going on in this scenario. When you call the doctor, the LIP, or respiratory, we want you to utilize that SBAR format and give recommendations and ask for orders. We may not give you the orders that you want or that you need, but we do this for 2 reasons. One, we want you to get used to critically thinking about the orders that you're given so that you can determine if they're appropriate for your patient instead of just doing them because they're ordered. And 2, we want you to get used to anticipating these orders in the future so that you're more prepared." The checklist goes on to cover several other topics that are important elements of the pre-brief. After adding all of these items, it was time to test the revised version. During the next simulation, it happened to fall on a day where the simulation team was observing and dashing us. The pre-brief section felt much less rehearsed and flowed better. After simulation, the feedback from the simulation team was positive and pointed out that it sounded very conversational and natural. Their verbal feedback from the learners was also positive and indicated that they felt more comfortable in the simulation lab after that. Overall, the checklist has helped to guide the facilitator and it has allowed for a more impactful simulation experience for the learners.